Serotonin syndrome. Well, in contrast to carcinoid syndrome, serotonin syndrome is just a drug-drug interaction, and it's not due to just tumors, and it's actually due to exaggerated serotonergic activity in the central and peripheral nervous system. Like when the patient is taking drugs that increases the level of serotonin in the body, like SSRI, serotonin selective serotonin reuptake inhibitors, or SNRI, serotonin norepinephrine reuptake inhibitors, or TCAs like tricyclic antidepressants or monoamine oxidase inhibitors. They all increase the levels of serotonin in the body. And apart from these, there are other drugs like triptans that we use to treat migraines in different patients, and also antibiotics like linezolid, and opioids like dextromethorphan or tramadol. And also there are certain recreational drugs that can lead to serotonin syndrome, and these include like MDMA, commonly known as ecstasy, or even cocaine or amphetamines, and LSD. These drugs all can lead to serotonin syndrome. And there are the different signs and symptoms of the serotonin syndrome actually. And among them, you can remember the signs and symptoms of serotonin syndrome by a mnemonic called mad hot twitches. Now, what does it mean? Actually, mad means that there is altered mental status, as we see in patients with serotonin syndrome, like the patient might be experiencing confusion or like delirium, or obviously disorientation, and in severe cases, obviously coma. And apart from this, the heart means the patient experiences the signs of autonomic hyperactivity, like the patient might be experiencing hyperthermia, which is the very hallmark feature of serotonin syndrome. And temperature is always greater than 38 degrees Celsius, and sometimes it exceeds even 41 degrees Celsius. That is 105 or 106 degree Fahrenheit. And it's a feature that we don't see in patients with carcinoid syndrome. And also signs of other autonomic hyperactivity, like tachycardia or hypertension or excessive sweating. And also the third thing that we see in patients with serotonin syndrome, that is twitches. That basically means that the patient with serotonin syndrome develop actually neuromuscular hyperexcitability, which the most common sign is actually the tremors and muscle rigidity. Another thing that we don't see in patients with carcinoid syndrome. And also the patient might be experiencing clonus, which are just oscillating muscle contractions, which also we don't see in patients with carcinoid syndrome. So for the diagnosis of carcinoid syndrome, its diagnosis based on these very clear-cut features, signs and symptoms. Its diagnosis is clinical. And for the USMLE, these signs and symptoms, you can just remember them by this mnemonic called mad hot twitches. And it helps obviously you to make a diagnosis of the serotonin syndrome as well. And then for the treatment of serotonin syndrome, we actually give just supportive care, like we give IV fluids, and for hyperthermia we give different cooling mechanisms. And also for anxiety and agitation, we can give the different sedatives like lorazepam or benzodiazepam. And also to block the peripheral effects of serotonin, we give cyprohepatidine, a drug which we also use in carcinoid syndrome, which you also know is cyprohepatidine is a serotonin receptor antagonist with an affinity for 5-HT2A and 5-HT2B receptors. And additionally, this cyprohepatidine also has H1 antihistamine properties, and also it has anticholinergic properties. So it greatly improves the symptoms which we see in patients with serotonin syndrome. Basically, it blocks the peripheral effects of serotonin, and therefore it obviously alleviates the symptoms in these patients.